Okay, so your eyes are red, irritated, they're watering like crazy. And guess what? It hurts more when you take your contact lenses out. So why is this happening and what's going on? Let me explain. All right, so I have patients that come in all the time. Their eyes are red, they're watering, they're itchy, they're irritated, they're in pain. I ask them, hey, so do you have your contact lenses in or do you have your contact lenses out? And they have their contact lenses in. This happens for one of two reasons. Number one, they don't have glasses. All right, fair enough. You can't drive here if you can't see, so we want the roads to be safe. Come on in, wear those contacts. But number two, the patient will invariably say to me, it actually feels better with the contact lens in. What? How is this happening and what's going on? Before I explain what's going on, let me remind you of this. The cornea is one of the most highly innervated areas of the body. What does that mean? It has the most nerve endings. So you know nerve endings, they're very sensitive. The cornea has 300 to 600 more times the nerves than your skin. Yes, that's crazy. You feel everything if something gets in your eye. If you've ever wore contacts, you get a little dust or debris under there, and it feels like you have stabbing, shooting knives going into your eye. Yes, it's painful because it's so sensitive. So let me use that information to relay what's going on. Either number one, you have a little bit of debris, some dirt, sand, maybe a piece of metal underneath your lid. So every time you blink, it's rubbing on the cornea. Well, the contact lens acts as a barrier. Or you got something in there. So we've had patients that get wind or dust blows debris, sand, stuff into their eyes. They flush it out, but it's still irritated. Well, the underneath of your lid should be incredibly smooth. So every time you blink, it just smoothly goes over your cornea, goes over that contact lens. But when it gets irritated, when it gets inflamed, it looks like a cobblestone road. Have you ever seen that with all those bumps? Imagine all those bumps going over that highly sensitive cornea. It feels awful. Or number two, you have an infection on the cornea. The cornea will try to fight any kind of infection that gets there, so we'll send a bunch of white blood cells, or if you get a corneal ulcer, you're gonna have a huge divot that's highly sensitive. Every time you blink, even a smooth lid is gonna feel irritating when it goes over that spot. So either the cornea is compromised or the lids are compromised. Let's go over how we treat each one. All right, so what do? Number one, if you can't get into the office right away, it's midnight, it's early in the morning, it's gonna be a little bit of time until you get into your appointment, lubrication is key. Preservative-free artificial tears are best because it's going to help reduce the friction, okay? So Sustain Complete, preservative-free is what I recommend. If you think it's the bumps underneath your lid, an antihistamine drop, so pat a day, extra strength, or once a day is something you can do until you can get into your doctor's office. But guess what? Both of these are gonna need a prescription eye drop, so get in as soon as you can. In the case of the lids being inflamed or the debris underneath, you're gonna need to remove the debris. So in the office, we can use special tools to get the metal out of the lid, or we can flush the eye to make sure if there's any sand or anything caught in there, we'll flush it out. Then we're gonna prescribe an antibiotic because we don't want you to get an infection, and two, a steroid drop. The steroid is gonna reduce the inflammation, help those lids go back to their normal smooth state. In the case of an infection, we wanna get you on an antibiotic right away. If the cornea becomes too compromised, one can lead to scarring, or two, the cornea itself can perforate, and that is not good. So we'll get you on a steroid if you have inflammation under the lids. If you have an infection, we're gonna give you an antibiotic. You're probably gonna be on the antibiotic anywhere from 7 to 14 days, depending on severity. You do not wanna wear your contacts. I know they feel good, it makes your eyes less irritated, but that can lead to more infection. Contact lenses are like sponges for bacteria and debris, and if you have a compromised cornea, that's the last thing you want on your eye. So you've had this happen, what can you do so it never happens again? Number one, try daily contact lenses. A daily lens is a fresh lens every day. We all know it. Whenever you put in that first contact, when you open it up, it feels the best. Imagine having that feeling every single day you put on a contact. That's what a daily lens does. You also toss it at the end of the day. So if there's bacteria, if there's debris, you're throwing it away. You don't have to depend on solutions or cleaners to get rid of it. Number 2, don't sleep or nap in your contacts. I know that a ton of contacts are incredibly breathable and they say that you can, but just because you can doesn't mean you should. Once you've had these things happen, a corneal infection or that swelling underneath the lid, you're more predisposed to have it happen again. So sleeping in the contact lenses raises that chance. Don't do it. So lastly, you want to practice good lid hygiene. The more bacteria and debris you remove from that area, from your lids and lashes, the less likely it's going to get on your contact, the less likely it's going to cause an infection on your eye. So those are simple tips and tricks you can do to keep your eyes feeling healthy, to wear those contact lenses and give you the best possible vision. So I love talking about the eyes. I love giving you tips, tricks, and methods to have the best possible vision. If you like what I'm talking about, like, subscribe, ring that bell. We have new content coming out every week.